And what you notice here is that as the knee flexes, the femur internally rotates, which contributes to maltracking the patella. So we've always thought that maltracking the patella was the patella moving off the femur. But that only holds true in a non-weight-bearing condition. With weight-bearing, what we've seen is that it's really the femur that moves underneath the stable patella. And this really changes the paradigm in terms of how we view and treat patellofemoral disorders. So in some of our modeling study, we have found that it only takes 5 degrees of internal rotation to create a significant increase in the patellar cartilage contact stresses. And this is as quantified with finite element analysis. So small degrees of femur internal rotation significantly increases the contact pressures underneath the patella. This is highly problematic. So when you look at a runner, and you can clearly see here that as he hits the ground, there's some internal rotation of the hip. There's also some hip adduction, which I'll talk about in just a minute. So transverse plane motion of the lower extremity is highly problematic here. There have been several studies that have pointed to the fact that excessive hip internal rotation is a very common movement impairment in patients with patellofemoral pain. And most of these studies have been conducted in runners, cross-sectional as well as prospective studies. So femur or